In its simplest term, an exchange is really, it's a marketplace for individuals and small groups to be able to go on and purchase health insurance, Travelocity, Expedia type of idea. So the government will not be selling insurance so much as it is just a marketplace for people to go on and be able to choose what commercial carriers have to offer.
Right now, estimates are at nearly 150,000 in terms of enrollees in just the first open enrollment period. And so these are all people who today are not covered. And so as an insurance company or a managed care organization thinks about that opportunity, it's a completely new market for them to be able to get coverage. And so that's where we align very closely in terms of goal. They want to get people covered and we want to get people covered. So I think that's the opportunity that insurance companies are considering as they think about participating in the exchange.
Obviously, time is a big deal, especially implementing a brand new enrollment eligibility system. Not like any other state, or just like every other state, we're facing some guidelines coming out, some guidance coming from the federal government. The goal is for it to be as simple as possible to be able to purchase insurance. An individual will come in, enter their information about, if they're interested in subsidies, entering their information about how much money they make. Insurance is such a confusing thing that we're going to be asking questions that help people sort of pare down based on their needs and what they're looking for, that will then help them be guided to a couple of specific plans from which to choose. For the first 2 years, the exchange will be an any willing carrier model. And it's important to do that in the beginning because you want to make sure that you have enough people on board.
We have a committee called the Plan Management Advisory Committee. That committee very specifically looked at the rules that should be in place for certifying plans and insurance companies to participate in the exchange, and really thinking through, all of the things that, from a quality perspective need to be in place to make sure that the plans that, will ultimately get offered to consumers meet the federal laws as well as meet the requirements of consumers.
You want to make sure that there are enough carriers, and our goal for the first couple of years is to really focus on getting those 730,000 Marylanders into the exchange. We're currently 13% are uninsured, so dropping that uninsured rate will be a very quick measure of success. I think 5 or 10 years down the road, I think it will be what has the exchange been able to do to change the way that healthcare is delivered within the state, and have we been able to drive costs down, and have we modified things? And I think that will be the measure.